This presentation by Dr. Brent Credille from University of Georgia is part of a 6-part series organized by Fort Valley State University, Dr. Niki Whitley and Stefan Price, and AgriUnity, Mr. Handy Kennedy.
It's an exciting opportunity, and thank you for that. I have been at UGA now for 7 years, and a large part of what I do is clinical work with beef cattle producers throughout the state, but also quite a lot of outreach to beef cattle producers through the state of Georgia, meetings like this, but also quite a lot of research as well that revolves around calf health, respiratory disease particularly. And I've heard here in the discussions over the last few minutes, people talk about high-risk calves and value-added health programs, and that's really sort of the approach that I want to take tonight is what can we do to look at herd health from the standpoint of adding value to cattle operations, and if we invest $1 in something, how can we get more than that dollar back? And hopefully we'll see some of that as we go through, and as we go, I'm still figuring out this Zoom thing, even though I've been doing it for 6 months now. Feel free to stop me at any point in time, ask me questions, something that may not be clear, or something you want more details on. I'm happy to spend as much time as you'd like me to, trying to cover as much as possible. So as we start, what I'd like to do is just give you an overview of how I look at herd health, sort of my philosophy on it. Then I want to start off looking at herd vaccination, sort of why vaccines are important, and where we stand as an industry, looking specifically at the beef cattle industry. From there, talk a little bit about the basic questions that I ask myself when I'm working with one of my clients and designing a vaccine program for them. Talk a little bit about implementing a vaccine program. And then one of the things you're going to notice is that as I go through and talk about vaccines, you're going to notice, I think, that they are, generally speaking, imperfect. So how can we make an imperfect product look really good? And that goes back to biosecurity. Once we get through that, I'll spend some time talking about deworming, some new things that we've learned about dewormers, what works, and also the economics of it, how we can, like I said, spend an extra $1 on dewormers, but make 10, 15 more on the back end of that. So when we look at, herd health, and we put herd health in the context of making money on a cattle operation, I think it's important to realize that the profitability of a cow-calf operation, a lot of different things affect that, but at the end of the day, a healthy animal is a profitable animal. The healthier they are, the more productive they are, the more productive they are, the more money that we're going to make. And when we look at designing a herd health program, what I really want to do is focus on preventing disease from the start. It is my goal to keep disease out as much as I possibly can. And at the end of it is that we find the expertise for those producers so that when disease pops up, hopefully on a relatively rare occasion, that the expertise is there to help deal with it when it does come up. And when you look at this from a monetary perspective, preventing disease is a lot more cost effective than dealing with it. We'll look at the economics of disease more in just a little bit. It may seem extreme to spend $4 per cow on some vaccine, but when you look at the cost of some diseases, that $4 is relatively cheap compared to what it would cost to have to treat it on the back end. When we look at herd health, is understanding that death is probably the most dramatic manifestation of disease that we normally encounter. And going out onto a pasture and finding a cow dead, it opens your eyes and makes you realize things that you may not have realized before. But when we look at disease, death is a relatively rare occurrence, and it's the sickness that we see that is economically really the most devastating. Those sick animals produce less. Not only do they produce less, it costs us more to get to the same point. So this dead animal, really just the iceberg, a much larger problem that's under the water. The other thing about herd health is understanding that it's not an all or none phenomenon. My goal is not to keep disease at a 0 level. Regardless of how good of a job we do, we're going to see sickness, we're going to see death related to age, variation in health status, and then just acts of God. I've been into herds where lightning strikes have killed entire populations of calves, and it's almost unavoidable. But my goal, as best I can, is to keep the disease incidence below some economically important threshold. So the way that we're going to do it and things that we're going to talk about tonight is I'm looking to attack the interactions that occur between some infectious agent, a virus, a bacteria, a parasite for that matter, the animal, and also the environment. So when we look at that, we're talking about enhancing the immune system through vaccination. Maybe we want to reduce pathogen burden through looking at biosecurity. We purchase a new animal, whether it be a cow, a bull, or a heifer. We want to do whatever we can to keep them from bringing a disease onto the farm. And then something that I won't touch on as much tonight is, along with vaccines and biosecurity, is giving those animals a productive environment. It's clean. It's not overstocked. There's enough forage, etc., so that we can put these things together and have the ideal herd health program. So with that, what I'd like to do now is spend the first little bit here talking about vaccines and the way I look at designing a vaccine program. So the idea behind the use of a vaccine is to either decrease the incidence or severity of some infectious disease challenge. And keep that in mind, is that if we don't have an infectious problem, vaccines are not going to be a tool that helps us. If we have nutritional issues, if we have issues associated with too much mud, etc., it's hard to vaccinate our way out of that. So it's important that we understand that vaccines are not a panacea and won't eliminate all the problems that we encounter. Ultimately, what I want to do with a vaccine program is to reduce treatment costs and reduce production losses. Not eliminate them, but reduce them as much as possible. So again, it's below an economically acceptable threshold. If we look at where we stand as an industry, looking at the percent of operations that vaccinate their cows for something, we look at it by location. You notice the Southeast over here on the far right, less than 60% of cattle producers in the Southeast vaccinate their cows for something. When you compare us to the Western U.S., Utah, Nevada, California, Oregon, we're over 75%, and in the central portions of the U.S., we're at 91%. So when I talk to people in the Western U.S., the Texas Panhandle, Kansas, Nebraska, our cattle have a bad reputation in the market. And a lot of that goes back to this here, where those animals, as they leave the farms, go through sale barn channels, without that health history, are at greater risk of disease. So this is a place where we can do a lot more to try to match the people in other areas of the country that have cattle with a much better reputation. Now, I said that 60% or so are vaccinating their cattle for something. If we look more specifically now and we say, what are they using in those herds, and we break it out by production class, calves that are less than 3 weeks of age, calves that are 3 weeks of age and older, replacement heifers between weaning and breeding, replacement heifers between breeding and calving, cows and then bulls, you'll notice that less than about 12% vaccinate calves that are less than 3 weeks of age. 2/3 of producers are vaccinating calves between 3 weeks of age and weaning. Just a little over a third are vaccinating replacement heifers between weaning and breeding. A quarter are vaccinating replacement heifers between breeding and calving. And then somewhere between 30 and 40% are vaccinating cows and bulls. If we look more closely at what they use, generally speaking, it's going to be blackleg. About 60% of producers, when they vaccinate their cows, they're generally using a blackleg vaccine, and that is going to be it, nothing else. If we look at replacement heifers between weaning and breeding, less than 20% are using a vaccine against IBR, and a very important cause of reproductive loss in cow-calf herds. If we look at replacement heifers between breeding and calving, it's under 12%, and cows it's under 25%. So even though we say that we're vaccinating, 60% of us are vaccinating our cows for something, we don't have a comprehensive vaccine program in place. And there's a lot more that we can do if we tease the data out and see where we stand relative to other portions of the country. With that in mind, where we stand, there's a lot of work that we can do. Are the things that I consider when I design a vaccine program for a cow herd? I ask myself 5 questions when I'm working with my producers that help me get a sense of what is best for them. There's a lot of resources that I have available to me. I can vaccinate for almost any disease that you can name. There's a vaccine for it. But the question I have to ask myself is it economically beneficial to that operation to include that? Can I do some good? Could I do some harm? What is actually going to work? So the first question I ask myself is, well, what are my disease risks? In this particular production system, what is the most likely thing that could pop up and create an issue in my herd? The next thing that I need to know is, what is the cost of that disease relative to the cost of the vaccine? If I have a disease that costs me $2 per cow, but yet the vaccine costs me $5 per dose, that may not make sense economically to do that. When does disease occur? Do I have anything available for disease control? And then lastly, and most importantly, do the products that I have available to me actually work for what I need them for? So if we look at my disease risks, and I look at the system that we're talking about tonight, we're talking about cow-calf production. And the idea behind cow-calf production is for this cow at a 12-month interval to deliver this calf. And for that calf, once it's delivered, to survive until the point that it's weaned and I get the paycheck from it. So when I look at disease risks, my concerns become, what is going to prevent this cow from conceiving this calf? What is going to prevent this cow after conceiving it to maintain it? And what is going to prevent this calf from surviving from birth through weaning? What diseases do that? Well, if I look at that, I'm looking at, okay, what are the reproductive bugs I'm concerned about? Well, things like IBR, BVD, lepto. If I'm purchasing a new bull, trick becomes a concern for me as well. If I'm looking at a nursing calf, well, I'm looking at the respiratory pathogens like BRSV, IBR, BVD, Mannheimia, and mycoplasma. I'm looking at diarrhea pathogens, coronavirus and E. coli, and then the pink eye bugs like Moraxella bovis and Moraxella bovaculi. I'm not saying that I'm going to vaccinate against all of these pathogens. I'm just looking at it and saying that reproductive diseases are a concern for me. These are the big ones that I worry about. Respiratory diseases are a concern for me. These are the big pathogens that I worry about, so on and so forth. Looking at, again, the production system that I'm working with. Next is going to be, what is the cost of disease? There's lots of different ways for us to look at the cost-benefit ratio. One is the economic cost. Does the vaccine cost me more per head than the disease? But other things for us to look at is, outside of that economic cost, what about the reputation? If we use a vaccine, would someone interpret our calves as being better quality? We use this vaccine, and because I use this vaccine, someone sees value in that, and that's okay. Regardless of whether it works or not, if somebody's paying that bill and there's a positive return for me, I'm willing to use that product. The other thing is that regardless of how important some disease might be, what if there's a social stigma that goes along with doing or not doing something? And so those are things that I think about, is within this system, outside of the economic costs, what about the reputation? What about the social stigma that go along with not doing or doing something that I've got to think about it and incorporate into my system? So when we look at the economic cost, we're going to look at pink eye. Pink eye is a disease that most people are familiar with. We in my herd deal with pink eye on a relatively regular basis, and we have good solid numbers on it. And what we know is that a calf with pink eye is on average going to weigh 30 pounds less than a calf that doesn't have pink eye. So in this scenario, we're going to look at a calf that weighs 600 pounds, and then that calf without pink eye is going to weigh 570. And the market prices that I have down here are a little bit generous given where current market prices are, but the idea is still the same. This 6-weight calf that does not have pink eye is going to return to me a little over $831. This calf with pink eye, because it weighs 30 pounds less, even though it's worth more on a per pound basis, is going to bring to me just over $795. Just looking at the difference in weight gain alone, pink eye is costing me $36 per head. Well, if I decide that I want to treat that calf with Draxxin, Draxxin is $5 a cc. This 5-weight calf, that's $25. The cost of the labor, the syringe, the needle to go along with it. You can see how this adds up relatively quick. We're looking at $75 per animal for a single case of pink eye. This is an economically significant disease. Next is, when does disease occur? The idea behind looking at this is asking myself, when is disease most likely to occur so that I have the vaccine on board prior to that challenge? So the immune system is ready to go. It's at its highest level before something happens. So this is looking at when disease caused by BVD occurs. And one thing you'll notice is that BVD can do a lot of different things. early embryonic death, abortions, persistent infections, congenital defects. But you'll notice that all of these different things can occur at different stages of gestation. It starts as early as the day of conception. So when we look at a disease like BVD, knowing that it does all of these different things and it starts doing all these different things relatively early, I really need to have the vaccine on board in the ideal world before conception ever occurs to prevent all of these different things from occurring. Next, are products available for disease control? This is the place that's the easiest one to answer. If you have a disease caused by a virus, a bacteria, in some cases parasites, we probably have a vaccine for it. This is looking at a list of products that are available from Boehringer Ingelheim in Canada. It was the easiest chart I could find on the internet. And you notice how many products are available, and not just how many products are available, how many different combinations of products are available. So if you've got something that you need to put together for a herd, I can find a vaccine for it. But then we get to the point where we ask ourselves, do those products actually work? So this is some data that came out of Auburn University where they were looking at how well do modified live IBR vaccines prevent abortions in pregnant cows. This type of chart is called a forest plot. And what we're looking at here on our x-axis is risk. In the ideal world, using a vaccine would take everything to the left side of this chart. It means it reduces the risk. If we move over to the right side of this chart, that means risk is going up. That's a place where we don't want to go. We don't want to see our vaccines move us to the right side. This vertical line here in the center at 1 represents no effect at all. The vaccine is neither good nor bad. What you're going to see over here is that across these 7 different studies, the average effect that it had, and then down here on the bottom, when we summarize those studies, the overall effect. And what you're going to see when everything is summarized together, that the use of a modified live vaccine to prevent abortions caused by IBR in pregnant cows is going to reduce the risk of abortion by about 80%. And that's pretty good. So using a modified live vaccine to prevent abortion caused by IBR in pregnant cows is going to reduce the risk by 80%. That's pretty good vaccine. I would take that. Not perfect, but I'd take it, and it'd be worth including in my program should I think IBR is a risk. If we look now at the prevention of persistent infection in cows that have been vaccinated against BVD, one of the things you're going to notice is overall, by vaccinating my cows, I'm going to reduce the risk of abortion by about 85%. So again, that's good. I'll take that. If we look first now at modified live vaccines, it's about a 90% risk of reduction. A killed vaccine, 75%. So again, we're seeing some differences here saying that modified live vaccines are probably better than killed, but when compared to no vaccine at all, both of them jump out above and there's a positive effect to it. We're going to come back to type of vaccine in just a little bit. The other thing to look at is whether I have a heterologous or homologous challenge. And what that means is that BVD is a big family of viruses. There are 3 types that we know of, and within each type of BVD, you can have up to 20 or 30 different strains of virus there. So in the ideal world, what I'd like to do is in the vaccine that I'm using, have as close to a wild type protection as I would see in nature. And what you'll notice is that, again, if I have the same strain of virus in my vaccine as they see in nature, I have much better protection. Where this becomes relevant is when you're choosing vaccines, when you see it as a 4-way, 5-way, or 6-way product, the more ways that are on that vaccine, the better protection you're going to get, because the more likely it is you're going to be able to cover the different strains that are out there in nature. So if you're comparing products and you see 4-way, 5-way, or 6-way, you always want to go 5 or 6-way over the 4-way to give you this broader spectrum of protection. But the last thing is you'll notice that here where we talk about field challenge, notice that there wasn't enough data to summarize. And what you'll see here is a lot of this data is coming from studies where they've challenged animals in lab settings and not in the field. And that's something to think about, and one of the things we'll talk more about when we get to biosecurity. So when we talk about putting it all together, we look now and we say, what is the cost benefit of vaccine use? So the things that I'm going to look at here to help me decide, is this vaccine worth it for me, is first the vaccine cost. How much per dose is this vaccine? The next thing that I'm going to look at is the disease incidence. How much disease am I seeing in my herd? Or how much do I expect to see in my herd? What is the cost of that disease? And how effective is that vaccine? We put it all into this formula down here at the bottom. So we're going to go back to the example of pink eye. And what we're going to see is that the vaccine cost is $1.23 per dose. The incidence that I expect to see in my herd, based on previous history or things I may have seen locally, is going to be about 15%. The cost of disease per sick calf is $60. That's looking at weaning weights, cost of treatment, labor, etc. And I'm going to say the vaccine is about 10% effective. That's probably generous when we look at pink eye vaccines. Generally speaking, most studies show that pink eye vaccine is neither good nor bad. It doesn't really have any effect. But we're going to say it's 10% effective. Maybe it's going to reduce some disease. So when we throw it into our formula, we're going to see that the benefit of using the vaccine is about 90 cents. It cost me $1.23 to use it. It's negative 33 cents per calf. So using pink eye vaccine in this scenario, just from an economic perspective, I'm losing money. The other way to look at this, though, would be to say, I have someone who wants me to use pink eye vaccine in my calves. Okay, fair enough. Well, I know that by using that pink eye vaccine, I'm losing 33 cents per calf. This is how much more I need you to give me for this calf to incorporate this vaccine into my vaccine program. So it gives us a way now to balance these things out and say, yeah, it may not work, but somebody's willing to pay for it and give me a premium to use it. Okay, fair enough. Let's do that. And now we have a way to sort of look at the benefit of that and what I may need to get for not doing something. So with all that in mind, how do we put that together and make something that's inherently imperfect look really, really good? So to start with, go to what I consider to be a core vaccine program. I'm pretty simple when it comes to designing vaccine programs for cattle herds. And if you look here at replacement heifers, brood cows, and also bulls, I'm going to get all of my coverage in a series of 2 injections. I'm going to get a 5 or 6 way viral respiratory vaccine. I want 5 different strains of lepto, and then a 7, 8, or 9 way blackleg. I can get all of this coverage in a series of 2 injections. That's it. If we look at my feeder calves, what I'd like to do is be pretty consistent. Again, I want to keep it simple, so the fewer products I can have on an operation, the less decisions that I have to make and figure out what goes where. But again, a 5 or 6 way viral respiratory vaccine, rather than lepto, because I'm not concerned about these guys and reproductive performance. I want a Mannheimia hemolytica leukotoxoid and the same 7, 8, or 9 way blackleg. Again, I can get all of this protection in 2 separate injections. When we look at when they should be given, in calves, both feeder calves and replacement heifers and bulls, I want 2 doses into those animals prior to weaning. In our herd, what I tend to do is, because we process our calves for the first time at 1 to 3 months, at that point is when they get their first dose of vaccine. Then I come back, they're weaned between 5 and 7 months, and they get their booster there. We'll talk more about that a little bit later. Again, in the ideal world, replacement heifers, cows, and bulls getting ready for the breeding season, I want those vaccines into them 30 days prior to breeding. Now, I say that, and that's what the textbooks might say is the ideal, but the timing of administration is not set in stone. The nice thing about vaccine programs, and some of the things we're going to talk about here in just a little bit, is we can make vaccine programs really, really flexible, tailor them to the individual operation so that it's convenient for you. Rather than making it maximized, we make it optimized so that it can get done. The next question is, well, what type of vaccine should I be using? And this is the place where it can get really kind of fun and really kind of confusing too. When we look at the different types that are out there, first you've got modified live. Modified live vaccines are exactly what they say they are. They are live viruses, but they've been weakened in some way. And they are, generally speaking, considered to be the gold standard of vaccines. The problem with modified live vaccines is that if I use them in animals that are too close to breeding, or if I use them in animals that are pregnant, I can create some issues of fertility, or I can actually cause abortions. So there's some danger associated with their use depending on when they're used. When we look at killed vaccines, they are generally speaking considered to be less effective than modified live. And most of the data out there would say that that's probably true. But the nice thing about killed vaccines is that they're safe for all stages of production. I can use them in pregnant animals. I can use them in nursing animals. I can use them in animals right at the time of breeding. And then you have combination vaccines. And these combination vaccines are a hybrid between modified live and killed, where I've got some components are live, some components that are killed. And what they're trying to do is bridge this gap between how well the modified live works and how safe the killed is. What the data is now telling us is it's saying that using a combination of product types is probably the best way to approach it. So for that first vaccine exposure as calves, they really need to see it as a modified live. For all subsequent boosters, they can have a killed vaccine or a combination product. And what we're seeing is that compared to using one type of product for all life stages, whether it's modified live, completely killed, completely, mixing those products, modified live first, killed, or combinations of the rest of their life, you've got better protection. And it's improved in safety for pregnant animals as well. So this is an example of a vaccine program that I put together for several clients of mine, and they seem to be pretty happy with this. And so what I do is that in my nursing calves, whether it's a bull calf, a steer calf, or a heifer, it doesn't matter, at 2 to 3 months of age, they're going to get an intranasal modified live. And the one we most commonly used is Enforce 3. That sets the stage then at weaning. They get an injectable modified live. Any replacement heifers that stay on the farm after that, 30 days prior to breeding, are going to get, again, an injectable modified live. And then once they become mature bulls or mature cows, I give an injectable hybrid vaccine pre-breeding or at preg check. And again, studies are showing that this approach, modified live first, followed by a killed or hybrid vaccine in maturity, gives you more flexibility in designing a vaccine program, but it also gives you a more effective and more comprehensive vaccine program than using a modified live across the board or a killed across the board. So just to summarize that, this is what I recommend for cow-calf herds, looking at calves, replacement heifers, cows, and bulls, blackleg across all groups, the respiratory and reproductive viruses across all groups. Notice the difference is here when I'm looking at lepto. I don't really consider lepto to be a risk in a feeder calf, so I'm more concerned about bacteria like Mannheimia. They're going to cause pneumonia. And the other thing is, and this is something that's relatively controversial, is the use of Bangs vaccines. For a long time, people have done it. I still have herds that do it because they market cattle into Idaho, Wyoming, and Colorado, where brucella is still endemic. But this is something that people still do to get permanent IDs onto the animals to make it easier to get animals across state lines. It's just something that's there, something you consider, but I don't really consider it to be core. Other things to talk about when it comes to vaccines is boosters. Boosters are absolutely essential, regardless if it's a modified live, killed, or a hybrid vaccine, to make sure they're as effective as possible. One thing I'm going to say about boosters is that it should always be done according to what the label says. So if the label says vaccinate 2 to 4 weeks after that first dose is given, make sure you try to do that. But one thing I will say is that if something happens and you have to deviate from that, that's okay. But don't ever boost before the label says you should boost. If it says 2 weeks at the earliest, don't vaccinate at 1 week. You have the potential there to do more harm than good. However, if the label says 2 to 4 weeks and you can't get to it until 6, 8, 10, 12 weeks, that's actually okay. And there's some data out there showing that that might even be a more effective way to approach a vaccine program. So that's one thing to keep in mind. Don't ever boost too early, but boosting too late is not necessarily a bad thing. Again, flexibility built into that vaccine program. Other things that I like to do to make vaccine programs and herd health programs in general more convenient is putting together a herd health calendar. Everything that I do in my life revolves around the calendar in my phone. And if it's not in the calendar in my phone, it doesn't exist. My birthday, if it's not in the calendar on my phone, it doesn't exist. It has to be there. And those of you guys who are in row crops and have other things, everything you do is based on a calendar. Why not do herd health the same way? So when I'm putting together a herd health calendar, I've got 5 questions that I ask myself. Is one, when do I want to start calving? Do I want to breed heifers before cows? How long do I want to calve my heifers? How long do I want to calve my cows? And then when do I want to wean? If I can answer those 5 questions, it allows me then to go to my calendar and start writing in dates. So I've got my pre-breeding, breeding, and post-breeding phases of my herd health program. Pre-breeding, I'm going to vaccinate my cows, and I'm going to do BSEs on my bulls. At breeding, I know this day I put the bulls in, and this day I take the bulls out. Then I'm going to preg check, deworm, and I'm going to wean calves and vaccinate. And what it might look like is something like this. I want my breeding seasons to start May 1st. That means I've got to get there 30 days before, and I've got to have vaccines into those cows, and I need to do the bull BSCs to get that taken care of. If breeding season ends on July 1st and I want to preg check, well, 60 days after that, I need to get it done. So September 1st, I'm going to do it. Calving starts February 1st, it ends on April 1st, and I'm going to wean calves and vaccinate them on August 1st. So I know it's in my calendar. I know when these things are going to get done. It makes it easier for it to happen. Other things is be careful when you're using vaccines and have realistic expectations for them. One of the things that you're going to see is the terms efficacy, and you compare that to the term efficiency. A lot of people like to talk about efficacy. As a producer, we don't really care about efficacy. That's a very controlled situation done in a lab setting with no natural anything associated with it. What we care about if someone comes to try to sell you a vaccine is how efficient is that vaccine. Not only do those animals stay healthier, but do I see improvements in weight gain? Do they lose less weight? Are there economic advantages in it for me? So that's something to look at when you're looking at vaccines is not only, well, if I have a cow in a lab in a stall that's sterile and I squirt virus in their nose, that's not real for us. We want to know in this setting, which is a natural model, do they maintain weight gain? Do we see less abortions, et cetera? So be careful with that when you have people come sell you things. Now, we've seen that a lot of these products are inherently imperfect, and that's okay. So when something's imperfect, how do we make it look good? And that goes back then to biosecurity. Biosecurity is what we do to prevent the introduction of disease-causing agents. And the reason why biosecurity is important, and you look at the poultry industry and the swine industry, and you see how good of a job they do with managing biosecurity on their farms, is you look at how does infectious disease spread. The most common way that a virus or a bacteria or some other pathogen gets into a herd is we go somewhere, we buy it, and we bring it to the herds ourselves. That is the most common way. So we purchase an animal that is either actively sick, has been sick, or is recovering, or it's incubating disease. That is the critical control point for a biosecurity program, is introducing diseased animals and preventing that from happening. Other things that could happen is contact with other animals, a neighbor and fence line contact with that neighbor's herd. People moving between herds, feedstuffs, and then inanimate objects, fomites. But by and large, the most common thing we see is I spend good money on a cow, I spend good money on a bull, I spend good money on a group of heifers that are sick and bring it in, and I have a disaster on my hands after the fact. If we look at USDA surveys, looking at herds that admitted to bringing new cattle onto their operation in a 12-month period, how many of those herds separated all, some, or none of the new additions? What you're going to see is that 2 out of 3 herds that said they purchased new cattle did not quarantine anyone for any length of time. So when we look at building a herd health program, take vaccines out of the equation for a second and look at a critical control point, this is it right here. If we're buying animals, we're building a herd from scratch, being cognizant of the fact that biosecurity and quarantine is important, and not a lot of people are doing it. So what goes into a biosecurity program? First is quarantine. And in the ideal world, I want to have those animals in quarantine for 2 to 3 weeks at a minimum. And while it would be nice to have them on separate areas of the farm, that's not always practical. So if I can prevent nose-to-nose contact, that's better than nothing at all. If I have a new animal come onto the farm, I'm going to test every new animal that comes onto my farm for BVD. And there's a lot of different ways I can test for BVD. I can use an ear notch. I can use blood. I can use serum. They're all the same. They perform the same. And then if I buy a new bull, regardless of what that seller tells me, virgin, mature, it doesn't matter, I'm going to test that bull for trichomoniasis. And I'm going to do that with a preputial scraper. There are other things that could create issues in cow-calf herds that may not be quite as high yield, but if they're a concern for you, anaplasmosis, Johne's disease, etc., we can test for those as well. When I look at a basic biosecurity program, quarantine, BVD, and in bulls, trich, those are the big ticket items for me. If these tests come back negative, they're healthy during that quarantine, I'm going to deworm those animals and I'm going to vaccinate those animals according to my farm protocols, and they can be released into the standing herd. So when we talk about don't have fence line contact, this is a situation here where these lanes separates these two fences by, I don't know, 4 to 6 feet. Is that enough? Probably not. Is it better than nothing? Sure. It gives us some assurance and we're doing a better job. We don't mix them right into the standing herd. So that's vaccination. That's biosecurity. The next thing that I want to talk about, and we'll finish up, is going to be parasite control. So when we talk about parasites, is when I came through vet school, this was 14 years ago. When we thought about parasites, we thought about animals that lost weight, animals that had diarrhea. These are animals with clinical signs of disease. What we see today, or at least what I see in the herds that I work with, is that I don't see diarrhea. I don't see weight loss with parasites. I can see significant effects on productivity with no signs of disease at all. And it's important to realize that parasites, like many other diseases that we encounter in cow-calf production, it's the subclinical diseases that's the most economically damaging. These animals have a decrease in appetite. What they do take in, they don't utilize normally. They'll have rough hair coats. They don't produce as much milk. It's hard to pick those things up. And so when I go into a herd, and I've certainly worked with these herds, where we have dead cows from parasites, like everything else we've talked about, that is the tip of an iceberg. And I've got a lot of other things that I need to look at under the water. So again, parasites are like every other herd health problem. It is an iceberg. So when we look at the economics of parasitism and what it costs us monetarily, there have been studies looking at the impact of deworming in cow-calf herds. And what they found, just to summarize a few, is that after treating mature cows prior to calving, calves born to those cows weigh 26 pounds more at weaning. It's because those cows are better able to utilize the feed they take in and they produce more milk. Replacement heifers that are dewormed appropriately, 15% more pregnancies. And the calves that are born to those replacement heifers weigh 10% more at weaning. So when we look at deworming and we look at parasite control, yeah, animals are healthier, but because they're healthier, they're more productive. And I look at dewormers as honestly a production enhancing technology. These are things that are an economic no-brainer. We're going to run through some numbers here in just a little bit to show you the benefit of incorporating these into your herd. So if you look at some studies that have come out, these are from, the first one here is from Oregon, the bottom two are from Louisiana. And if there's a place in this country that is hotter and more humid than the southeastern United States, it is going to be Louisiana. But the work from Oregon found that parasite-free stocker calves gained anywhere from a quarter up to a half pound more day, kilograms more per day than calves that were not dewormed. Same data, again from Louisiana, a quarter pound more per day in both of these studies, separated by the better part of 15 years. So again, we're talking about a quarter pound a day. And if we look at a 60-day growing period, that's going to be an extra 15 to 30 pounds additional weight. Again, these prices are probably a little bit generous relative to what the market's providing today, but that's an extra $24 to $48 per calf in my pocket, depending on what types of gains that I get. If I've got 100 head, that's an additional $3,000 to $5,000 in my pocket. If I just used a white paste dewormer like Safeguard, Synanthic, Panicure, Valbazin, it would have cost me about $1.50 per calf. That represents a 1,500 to 3,000% return on my investment. To give you some reference for that, if I invested this same $1.50 in the stock market today, year in, year out on average, I'm getting 6% back. Here I'm saying invest that $1.50 in dewormers for your calves, you're going to get 1,500% back. So it's a pretty good investment on a per calf basis. Some other work looking at the cow herd now. This study actually came out of the J. Phil Campbell Research Center here in Watkinsville. They gave cows the low end of the label dose of Panacur in May. And what they found is that the cows that were dewormed, 98% were pregnant at the end of the breeding season versus the cows that were not dewormed, 75% were pregnant. At the end of it, 90% of those cows calved versus 68% here. More recent study that came out of Montana found that in animals that were given the same deworming protocol, Panacur, 91% were pregnant versus only 81%. So if you look at those numbers, and we assume that calf that those cows produce is going to weigh 500 pounds, every calf they produce is a steer, and that steer is going to be worth $1.60 a pound. In the herd with 91% of the cows being pregnant, that steer is worth $728 per cow. In the herd where only 81% of the cows were pregnant, that calf is only worth $560 per cow. The dewormer, just using Panacur, would have cost me $4 per cow. And because I decided not to invest $4 per cow, I lost the opportunity on nearly $17,000. That represents a 4,000% return on investment. So again, these are not sick animals. There's no disease, there's no weight loss. These are just animals that didn't conceive. And it's only 10 percentage points. It doesn't seem like it's that much. But when you look at the impact of those calves and the carrying cost of an open cow, it makes a big difference. And to think about $17,000 more in my pocket at only $4 per animal, it adds up relatively quickly. This is some work that came out of Iowa State University in the early 2000s where they looked at if I take different technologies out of cow-calf production, implants, dewormers, fly control, etc., what happens to my break-even price? What happens to the cost per head? And what you see is that if I remove dewormers from cow-calf production entirely, if I move from a conventional system to, let's just say this is an organic system, if I take dewormers out of cattle production entirely, my break-even price increases 34%, and it cost me an additional $165 per head to get to the same point. It's just a dewormer, that's it. And these are 2007 numbers. So this is probably inflated relative to what we see today. So that's the economics of it. And you'll see that, again, dewormers are a relatively wise investment. And so if we look now at the percent of operations in the U.S. that don't deworm different classes of cattle, what you'll notice is that about 90% of us are actually getting a dewormer into or onto our cows. But the bad thing about it is that that's a low-risk population of animals, particularly a mature cow. By the time we get a mature cow to 3 or 5, depending on how much Brahma influence they have into them, they may not need a dewormer as much as these populations do. And you'll see that these higher risk populations, stocker calves, replacement heifers, 25% of us aren't deworming replacement heifers. And I actually visited a herd today that we see some challenges deworming their replacement heifers. We have a lot of work to do there. And our stocker calves, 40% of us aren't deworming our weaned stocker calves. So a lot of room for improvement there in a higher risk population of animals. And so when I look at dewormers and what I recommend is there's a couple of different ways to do it. If I have a herd and I'm not keeping calves on the farm after weaning, I'm pulling them off the cow and I'm sending them to the sale barn with no period of time for adaptation, what I like to do is a combination white paste dewormer and an injectable together at the full label dose at 3 to 5 months of age. If, however, I am keeping my calves on the farm after weaning for 45, 60, 90 days to grow before they get shipped to the sale, I want to give them that same combination white paste or injectable dewormer at the time of weaning. We're going to see some of this data here in just a little bit, but you notice that I'm using combinations really across the board. And the reason for that is resistance to dewormers is a huge issue. Those of you guys who have sheep, goats particularly, have encountered this. Cattle production is getting to that same point. So the porons and injectables, we see a lot of resistance to them. That's why adding in this paste goes a long way to increasing efficacy. And again, I'll get to some data that we've generated over the last year in just a second. Now, I mentioned the white paste dewormer. A lot of people think the paste dewormers are inconvenient because I've got to put it in their mouth. Well, this is a study that came out of Louisiana where they looked at 5 different groups of animals. And the ones to pay attention to are here highlighted in this red arrow. First, I've got the poron. In this case, they use Cydectin poron. And here I've got the Synanthic, which is Baron Gringelheim's counterpart to Safeguard. What you're going to see over this 60-day growing period, the animals that got Synanthic, that white paste dewormer, gain 22 pounds more than the animals that just got the poron. So just keep that in mind. Just by using that paste, I'm getting 22 pounds more. Something I'm going to do anyway, but switching it up a little bit, using a dewormer that's going to be more effective, I've got 22 pounds more, which is going to equate to about $30 extra in my pocket. Now, when we talk about replacement heifers, in the ideal world, what I'm going to do is that as those replacement heifers grow and at the time of weaning, I'm going to follow the same guidelines for what I just talked about. And in those replacement heifers, what I'd like to do is give them an injectable and an oil paste, again, prior to breeding. There are some situations where the time between weaning and breeding can be quite a long time. In some situations, adding an additional deworming in between these two time points can be beneficial. 10 to 12 weeks after the first, it gives us a nice broad spectrum coverage that's going to help us improve weight gains. And then lastly, in cows, I can get by with just an injectable, and what I want to do in the ideal world is 30 days prior to calving. I'm going to enhance milk production in those cows as they nurse those calves. And in bulls, if they pass their BSE, I'm going to get an injectable into them prior to breeding as they go into work with the cows. The reason I talk about combinations, and again, I'm going to show you some data here in just a little bit, looking at the economic impacts of this, is first, you're going to see here Sidectin and here Ivomec. This could be an injectable, this could be a poron, it really doesn't matter. What you're going to notice is that between birth and about 2 years of age, these products really don't work that well. What we're seeing in some of our weaned calf population is we're at about 60% efficacy. So resistance in this population is really, really bad. As they get beyond 2 years of age and up to about 3, that efficacy increases because we see a shift in parasite populations. But what you'll notice is this blue line here, which is the combination, is almost 100% effective regardless of life stage. Regardless of life stage, 100% effective. And the data that we have, and I'm going to show you some of this in just a little bit, is we are at about 98% efficacy using combinations compared to just this with one. So here's some work that was done by a group of parasitologists here at UGA. And what they found is in these weaned calves, given ivermectin, 2 weeks later, a fecal sample collected, the fecal egg count actually went up as opposed to down. So this is how bad the resistance is to things like ivermectin here in the Southeast. Now, it didn't go down, it actually went up after they were dewormed. Something that's probably a little bit more realistic, looking at poron Eprinex, what they found was if I deworm them at weaning and I come back 2 weeks later, collect a fecal sample from the same calves, using just Eprinex, the fecal egg count only goes down 26%. That is the definition of resistance. But if I combine Eprinex, in this case with Safeguard, I go from 26% to almost 98%. Much, much more effective. Well, if we look now across the U.S., and we have, in this study done by the USDA, about 30 herds. And we have herds that looked at brand name porons, generic porons, brand name injectables, generic injectables, and then oral paste. What you're going to notice is that using 90% as our cutoff for efficacy, notice that if I'm using a brand name poron, it's a 50-50 shot as to whether or not it's going to work. If I've got a generic poron, 75% of those herds are resistant. A brand name injectable, it's 17% are resistant. And we come down here to the white paste dewormers, it's 0 resistant. This is the scope of the problem that we're working with today, is we have a lot of resistance to the poron product particularly, but even to the injectables as well. So the one thing I want you to take away from this is, one, if I'm using a poron dewormer, which I don't necessarily encourage, make sure you use a brand name. Yes, they're more expensive, but they're also more effective. And this data lays that out pretty clearly. Make sure you use a brand name. And I'm not here to say this because I want someone, nobody else pays my paycheck. I don't have any drug company in my pocket, but brand name products work a little bit better. And you'll also see again down here, the injectables work better than the porons. So if we can make this switch, we can go a long way, again, to getting that economic return that those dewormers give us. So I keep mentioning this, and so here it is. The question that we've always had is, it's pretty clear that the combination dewormer is more effective. But the thing that I've never been able to get from anybody is, well, what's the benefit to my clients? If I ask them to spend another $1, am I going to get that $1 back? And so this is a study we did across several experiment stations here in Georgia. We had a group that wasn't dewormed, a group that got just a pour-on, a group that got just the paste, and then we had a group that got both deworms. And what you're going to see is that one, regardless of what we used, pour-on, drench, or both, there was a positive return to that. So deworming has a positive return on weight gains. But what we found is that when we compare it to doing nothing, the animals that got a drench, just Synanthic alone, generated $12 more per head than the group that was not dewormed. And if we compare the drench to just the pour-on, it's an additional $6 per head. That's a very, very positive economic return. So here we're seeing data showing that one, not only are they more effective, but there's a positive return to it as well. And this is something that I would encourage you to start doing, is begin thinking about the use of a combination dewormer in the herds, particularly in calves, which are going to be a higher risk population. And not only, again, are you going to see more effect, but you're going to see more money in your pocket at the end of the day as well. So to finish up, I know that was a lot of information in a relatively short time, is to understand that parasites can cause significant problems in cow-calf herds. A lot of it goes back to a decrease in appetite, alterations in how they handle nutrients. And when you look at the use of dewormers, it is a wise investment. It improves herd health, cow productivity, and at the end of the day, farm profitability, and that combinations are going to be more effective than individuals. And with that, the other thing that I want to touch on, and I've heard people mention this tonight, is castrating your bull calves. This is probably one of the most profitable tools you have available to you as a cow-calf producer. Last night, as I was finishing this up, I looked at market prices here in Athens, and what I saw was if you took the same two calves, but one's a bull and one's a steer, that steer is going to bring an additional $10 to $15 per 100 pounds of body weight. So for a 5-weight calf, that's an extra $50 to $60 in your pocket. Castrating bull calves makes you nothing but money, regardless of what time and other things you put into it. The other thing that you're going to see is that not only does it put more money in your pocket, as those calves go into either a stocker phase or into a feed yard, they're going to be healthier as well. They're less likely to get sick and they're less likely to die. And one thing I'm going to say, and this is something you'll get different opinions on, but I'm going to show you some data here in just a second to sort of justify what I'm going to say, is do it as early as possible in that calf's life. If you have to castrate that calf at the day of birth, castrate it at the day of birth. That is the best time to do it from a welfare standpoint without losing any returns on it. This is some work that came out of the University of Florida where they looked at steers and bulls. And in this study, steers were castrated at birth, bulls were castrated at weaning. What you're going to see is that weaning weights in these two groups were the same. Average daily gain from birth to weaning was the same. But the place where it was set off is in their post-weaning performance. Those steers gained almost 1/4 pound more per day in the preconditioning phase than the bull calves did. So the one thing you're seeing here is, again, taking those testicles early in life is not impacting performance negatively in the nursing phase, but when they get here to the post-weaning phase, they perform better. This is some other work, again, out of the University of Florida, where they castrated calves early at 36 days of age and late was 131. So we're looking at a month of age or about 4.5 months of age. Not a huge difference, but still what you see is, again, weaning weights are the same. Weight per day of age is the same. There's no difference in performance. And that's one thing to keep in mind, is that taking those testicles does not impact weaning weights negatively. It only enhances 1-year returns and the performance on the back end because you're not setting them back quite as much. So with that, I'll be happy to take any questions that anybody might have.
I just want to say that that little tidbit of information about the vaccination window, being able to stretch it out further than what's recommended on the bottle was a very good piece of information. I actually, I guess about 2 months ago, a producer of mine missed his vaccination schedule by about 3 months. And I told him that, you know, I can't promise any benefit from vaccinating from his boosters, and he declined to booster. And I wish I would have known that I should have gone ahead and boosted him. Thanks for that piece of information.
Well, thank you for your comment in it.
Yes, I have a question. This is Latricia Wilson. Great presentation. Have you noted any differences in terms of vaccination, dewormers, kind of an overall, if there's a difference in the breed of the animal Like maybe I know one of the presentations we had a couple of weeks ago, they talk about the Angus cattle genetically is better suited for certain things. Did you note that when you looked at the vaccination versus the dewormers? And then secondly, did you note come across any studies where they looked at grass-fed versus regular feeding? Did that have effect on your results that you presented tonight?
Sure. So in regards to your first question, looking at breed differences in vaccine responses and dewormers, the most common thing that we encounter, it is probably more related to dewormers, is any animals that have heavy Brahma influence in them. Anytime you have an animal that has ears, a hump, and skin, they are more likely to have problems with parasites than the non-Brahma influenced animals are. And so what we tend to see is that you can have Angus, Simmental, Hereford, what have you, the British continental type breeds, is by the time they're about 3 years old, you can really get to a point where very, very few of those mature animals need to be dewormed. But if you look at Brahma influenced animals, it takes them another couple of years to develop the immunity to parasites that the other breeds develop a lot earlier. So you'll find that you have to wait until they're 5 or 6 before you can really back off of deworming the mature animals there. So that's probably where you see the biggest thing as it relates to that first question is any time you have heavy Brahma influence, it's going to impact your deworming strategies more than it is anything else. Your second question, grass-fed versus more conventionally produced cattle, it probably goes back as much as anything else to the nutritional plane of the animals. What I sort of say is that I can feed my way out of a worm problem, but I can't worm my way out of a feed problem. So it goes to production stage and making sure that those animals are on an adequate nutritional plane. If nutritional plane is adequate, there should really be no difference in response to anything. In fact, you'll have an animal that has a much more robust response. Parasite burdens are going to be lower. Their ability to withstand any type of infectious disease challenge is going to be greater because I'm matching the nutrient needs. So I guess in a roundabout way, what I would just say is that it shouldn't matter the type of production system, grass-fed versus conventional, as long as I'm meeting the nutritional needs that are there. That's probably going to be the biggest difference is can I meet the needs of a growing calf with just forage alone? I mean, you can do it. But if I don't have the right forage makeup in that system, it could be potentially hard to do that.
About the extent of time, you're saying that, if I'm hearing you correctly, you're actually saying that there's no need to deworm cows that are 5 or 6 years old?
So there is a group of researchers at Louisiana State who are now, because of the resistance issues we see in cow herds in the Southeast, are now saying that if they have cows that can't make it after 5 years of age without a dewormer, those are cows that they are going to think long and hard about keeping around in their herd. And again, that's a situation where resistance is such a problem in that area, even with dewormer combinations, the only way they can manage it is by not using them. So to allow them to develop an immunity and handle the parasite burdens themselves.
Okay, I got you. So would you recommend actually testing some of the older cows, getting the fecal egg count on some of the older cows prior to deworming if possible?
So that's an option, is fecal egg counts. And if the economics are there, and I think fecal egg counts in our lab are about $20 a piece, so they're not inexpensive. The other thing is, in addition to fecal egg counts, is looking at body condition. A fat, happy cow that reproduces every year, weans a heavy calf, probably not going to have a big parasite burden. But if you've got cows every year that come through, they're thin, rough hair coats, wean-like calves, maybe those are the cows that are better to be dewormed, or maybe because they're weaning like calves and aren't giving you a return, maybe we need to just get rid of them from the start. So we can look at body condition, we can look at fecal egg counts, trying to use some objective measurement to give us some sense of where things might be.
Okay. All right. So I guess the best approach would be actually sitting down with the producer to work out a worming schedule, to actually work out a plan.
Yep. To sit down with him, work out a plan.
Worming everything that comes through the chute.
Yep. And it's a hard thing to do. I have a 60 head herd, and I still have trouble not deworming the cows. It's a hard thing to do because It's hard. So if I can find the 10% that don't need it, it makes me feel better to know that I'm going to get some benefit out of it without losing a lot too. So and it's still something, even when I talk to what I would call the experts, I can't get a clear answer on what exactly to do. So I'm still trying to work those out in my mind. And again, what people seem to think is that if I can find the fattest 10% of the cows in my herd, don't deworm them and target the other 90%, it's a good balance.
Okay.
Dr. Credille, this is Dr. Noble here. Enjoyed your presentation. Do you have any perspective on castration methods? You mentioned earlier as you can.
Yeah, so I mean, we can kind of get into the weeds as far as what's the best way to approach it, and that really gets more into the welfare implications of castration than it does really what works better than another. And so what I tell people is that use what you're comfortable with and what is familiar to you. If you are okay with knife or band or clamp, use that, whatever you're happiest with, to make sure that it gets done. Once you get comfortable with it and are okay with doing this, we can refine those methods to get to a point where we use something that may be more, I guess for lack of a better word, socially acceptable in the long term. But up front, just by castrating those calves, regardless of how we do it, we're having a positive impact on welfare as they enter into other production chains. So I think that if you like a band, use a band. If you like a knife, use a knife, whatever you're happy with, just so long as it gets done, because to me, that's the biggest benefit of it.
Do you see any methods where farmers make the most mistakes?
The most common method that I think is probably the band castration. Too often I see where they don't get both testicles down, or in some cases something happens and both testicles slip back up and they take the bottom of the scrotum off rather than the testicles. So that's the one that probably has the most error built into it. And again, the most common thing that I see is rather than getting both testicles, they leave one there. And it's not something, you haven't done a lot for the calf by still leaving that one there. So, using the band, you just have to be cognizant that, yeah, one can slip out. You have to make sure that you have both. But it is effective and it works very well. But the band's probably the biggest issue that I see. And I guess going along with that, if you are banding calves, the risk of tetanus is a lot higher. So in my vaccine program, I'd want to include a vaccine that has tetanus in it, which is where that 8 or 9 week black leg comes in, the tetanus protection in there.
I actually have a question or two. My first question is, how long of a quarantine time do you put some of your cattle on? Like, what is your professional opinion?
In the ideal world, we would quarantine for at least 3 weeks. And that 3 weeks goes back to if they are infected with something, virus, bacteria, that 3 week period of time will almost ensure that they're not shedding anymore after that. You can get away with 2 weeks, but you're going to lose some of those animals that may shed for a little bit longer. So I'd love to have 3, but I can live with 2 if that's the best that we could do. And that 2 weeks is going to balance it pretty well. It's going to get 90% of the animals. 3 weeks is going to cover 100% and take that risk to almost nothing. Nothing is certain, but 3 weeks is better than 2, but 2 I can live with. So with BVD, if they are persistently infected, the quarantine in and of itself is not going to be sufficient. That's where the test comes in. And that's why if I've got anybody bringing a new animal onto the farm, testing them for BVD is part of the quarantine protocol. They need to be tested and they need to be negative because they may be perfectly healthy and still shedding that virus. One of the worst abortion storms I ever saw was associated with an animal that was persistently infected with BVD. She was healthy, happy, you never would have known. And they had fence line contact with another producer's operation, and they lost multiple mature cows, nursing calves. They had abortions run through there, and it came back to infected animals. So that test is essential to picking them up.
I know you said do a trick test. What's the percentage infection rate of trick in Georgia? Do we know?
In Georgia, it's less than 1%. If I remember the data correctly, it's like 0.6%. So it's not common, but it is there. And trick tests are inexpensive enough that when I've got somebody bringing new bulls onto an operation, that it's an insurance policy for me. But it is here. We have found it. So it's not a no risk thing at all, but it is less than 1%. So the risk is low, but it's still there.
I have another question. When it comes to the hay with deworming the cows, would you think it'd be a good idea to mix like the deworming paste in the mineral, loose mineral, or what would you recommend, or just trying it by mouth?
I wouldn't. Generally speaking, anytime that I could avoid relying on a cow to decide what she needs to take in, whether it be feed, whatever, I like to try to. But I trust them to take in what you think they need to take in. So anytime I get the chance, the drenching guns that we have available to us today are easy to use. So I'd like to know that if the dose is 10 cc's, whatever it may be, that they get that full 10 cc's and there's not any variation that's going to occur with that. So I like to try to avoid mixing in feed if I can, although there are situations where, it's unavoidable. But if I can get it into them and know that they got the full dose without any question, that is preferable to me. Well, I really appreciate the opportunity to be here tonight. And any questions that you guys might have, please feel free to reach out to me. My email is all over the internet. You can find it. And Dr. Whitley has it as well. So please feel free to contact me if any other questions pop up. I'd be happy to answer those. But again, thank you for having me. I really enjoyed this opportunity, and I look forward to working with you guys again soon. Thank you very much.